If a child is having a functional constipation, yelling, screaming, and punishing do not work. A reward system, maybe with stickers or something, and if the kid makes progress, would be a better way of approaching it?
Absolutely. I have seen dozens of unfortunate children who have come to me after they've been to the psychiatrist. These parents, and unfortunately even their physicians, have failed to recognize the level of pain and fear that these children have experienced, and although they have provided them with a very reasonable approach for the child of their age to have regular bowel movements, they're not taking into consideration what this child has experienced. I always say to the mom, if you were continuously banging your head on the wall, you really wouldn't want to go back to that same place where you could find yourself hitting your head on the wall all over again. The child is the same way. The child does not need to go to the psychiatrist or the psychologist because the child is avoiding pain, and all rational people will want to do that.
Positive reinforcement is better than a negative reinforcement.
Well, negative reinforcement should have no role whatsoever in this. You can't force anybody to have bowel movements. That's the way that the child can have control over the situation, and most of the time the reason why they're exerting that type of control is to avoid pain. So it's very rational. It shouldn't be viewed elsewhere. However, as far as getting the routine down, this is going to, you'll see in a moment, this is going to be a regimented procedure, and one should reward the child for participating in the procedure. One need not reserve the reward until they get the outcome. One needs to be following their commitment, because if the commitment is there, then the results will follow.